And we'd like to start by asking Diane Sondheimer to just kick us off with the welcome from the branch.
Great. Thank you, Michelle. Hello, everyone. I'm Diane Sondheimer, the Deputy Chief of Child, Adolescent, and Family Branch here at the Center for Mental Health Services at SAMHSA. I want to welcome everyone to this webinar today, and thank you for joining us. I know the Mental Health Initiative, or CMHI, represents the largest and most significant federal investment to improve the lives of children and youth with serious mental health challenges and their families through a system of care framework. One of the major goals of the system of care grants is to leverage partnerships, to change and transform systems, and ultimately to create better outcomes for children, youth, and their families. We're fortunate to have an outstanding team of program partners to support the expansion of systems of care across the nation. And we're very pleased to welcome the TA Network to the CMHI team of program partners. The TA Network brings together national experts from prominent organizations and universities, and we're confident that their model and expertise will provide exceptional, relevant, and very responsive TA to our CMHI grantees. The TA Network has already begun to work with the other CMHI program partners with whom you all are familiar. An outstanding partnership has been developed between the TA Network, led by the Institute for Innovation and Implementation at the University of Maryland School of Social Work, National TA Center for Children's Mental Health at Georgetown University. Both have important roles and the strengths, and together with the National Indian Child Welfare Association, or NICWA, who continues to provide support to tribal grantees, these three partners have teamed up to provide TA to grantees that is really tailored to your needs and reflects your feedback. The national evaluation, an integral component of the CMHI program, is led by ICF Macro and WestStat. Together, two entities lead the national evaluation team, which development, implementation, analysis, and reporting of the national cross-site evaluation. ICF Macro continues to conduct evaluation for CMHI cooperative agreements in 2009 and 2010, while WestStat is responsible for the evaluation for the expansion planning grants and expansion implementation cooperative agreements. So marketing activities are supported by the Caring for Every Child's Mental Health Campaign TA team, which is a partnership between Vanguard Communications and the National Association for State Mental Health Program Directors. They are funded through a contract to help each system of care community develop and implement public education, social marketing campaign, including the planning for National Children's Mental Health Awareness Day on May 8th, 2014. In addition to the above referenced resources, system care communities also have access to two rehabilitation research and training centers, or RTCs, that CMHS funds with the National Institute on Disability and Rehabilitation Research at the Department of Education. These include the RTC for Pathways to Positive Futures, supporting successful transitions for youth and young adults with serious mental health conditions at Portland State University, and the Learning and Working During the Transition to Adulthood RTC at the University of Massachusetts. The CMHI program partnerships continues to grow and evolve as your systems of care continue to develop and advance. I'm confident that the training, TA, and support and education provided collaboratively by all the CMHI program partners will help you be successful in achieving your goals. Just a reminder that the guidance you receive is not meant to replace the authority for your government project officer or GPO and SAMHSA's grants management staff. So if you have any questions that are related to your actual grant requirements, they'll be directed to your GPO. Again, thank you for joining this webinar, and I'd now like to introduce Michelle Zabel, Project Director for the TA Network. Michelle?
Thank you, Diane, and thank you for taking the time to do this webinar with us. I want to also thank all of the attendees that have taken the time out of their very busy schedules to join us. I know that in the system of care community, there's a lot of overachievers and go-getters, and we had at least 30 of them on the call as we prepped. So thank you for your patience during that half an hour that you listened to us all getting on, and welcome to the TA Network. I'm very excited to be able to kick this webinar off and introduce you members of the TA Network, although I feel like because of the people that have pulled themselves together to create this effort, most of you know many of the primary partners. So I believe that as we go through this webinar, you're going to recognize old friends and people that have consulted with you in the past and been part of the development of your efforts and your systems of care. And we at the University of Maryland, at the Institute, we're just really pleased to be part of helping organize and create this model with our friends and colleagues across the nation that we've been working with for a number of years. So I hope you recognize people. I hope that through this webinar, you're able to better understand the various components and opportunities that are available to you as grantees through the network, and then obviously with our various program partners that Diane have just talked about. We're grateful to them for joining us today as well, and for their welcoming the network into the effort to really improve and expand system of care work across our country. So to get started, I wanted to make sure people knew that our mission as a TA network was to develop effective service systems and establish skilled workforce that can expand and sustain community-based systems of care. We really took the perspective in applying for this opportunity with SAMHSA that there had been tremendous growth and efforts in our country in the last 20 plus years when it comes to system of care, and that the states and communities that have been participating with the grant efforts, as well as all the other child-serving efforts out there, we were at a different level, and we were moving into healthcare reform. And it was an opportunity for us to, as a group of experts around the country, network together and provide support to each other moving forward. And that really philosophically drove the coming together of the network's experts into this collaborative. The Institute, as you've heard now on numerous occasions at the university, took the lead in actually contracting on behalf of our partners with SAMHSA, and we maintain the responsibility for the administration, and you'll see throughout this process many of partnering with many of the kind of lead areas that are available to you through the task order. We have 10 other partners that are part of the TA network, and we have approximately 150 consultants, some of which are on the phone right now, that really round out the expertise throughout the network. And we'll talk a little bit about that as we move forward. And I'm going to ask people to go ahead and mute their phones again so that we don't get the background noise, if we could. In terms of the key core partners, this is our list, and as we move forward through this webinar, many of these folks will be presenting brief segments of the webinar and explaining their role in terms of the network. But we have Accountability Solutions led by Kelly Hyde, who is part of the National Wraparound Initiative effort in this task order, Center for Community Learning led by Miriam Serna and Catalina Booth, both who will talk on behalf of USF, who is Kathy Lazier, who is unable to join us today, but the partnership between Center for Community Learning and the University of South Florida, led by Mario and Kathy and others, Mary Armstrong and others, really hub a lot of our cultural and linguistic competence work of work. We have the newly formed family-run Executive Director Leadership Association and the National Federation of Families, which constitutes the work in terms of our family-driven care and organization development work as part of the network. And then additionally, Portland State University and the University of Washington, in partnership with Accountability Solutions, leading the National Wraparound Initiative work. We're thrilled to have Youth Move as a partner, And Lacey will talk about the work being done through the network in terms of youth-driven care as well as youth organization and leadership development, and then obviously the Institute as well. Within the key staffing roles, we've provided you both names and email addresses so that obviously we would want you to contact us with any questions that you have moving forward. I, of course, am the project director. The co-deputy project directors include Marlene Matarese and Denise Stolzbach, and you'll be hearing from them later. We have technical assistance support coordinators listed here, business leads, media directors, and so on. And so I would ask that you put us in your email distribution list and feel free to communicate with us at any time that you have questions or any information you might need. At the bottom of this slide, you'll also see the Tuesday Telegram quarterly TA Network newsletter. Hopefully, everyone on this webinar has been signed up for the TA Network's communications. If for any chance you haven't, as we're communicating with you with initial phone calls and so on, please make sure we've got everyone that you would like from your community, state, grantee listed and receiving the communication. Please make sure that if we're not communicating with you, that we get your name, role, and email address so that we can get you on these distribution emails. This is one of the ways that the branch also uses as a mechanism to communicate any of the information they want to get out to grantees as well. So work with us on that, I ask you. Thanks. In terms of the roles, most of you at this point have received email distributions, assignment of either experts or coaches or whatever it was that your community most desired in terms of receiving technical assistance. But I wanted to take a few seconds and just define the roles that we have that you'll be most interacting with when it comes to your individualized technical assistance. And one is the technical assistance support coordinator. You saw their names in the previous slide, which Reese Hackforth, we've got Ron Shanahan, Becky Bertel-Lehman, and you've got their email addresses. Each one of them has been assigned a grouping of grantees by state, and they are really there to help support your needs, organize the technical assistance that's come to you, do policy or finance or clinical research for you, and provide you with any of the most up-to-date information that you're interested in. They will be available and respond as needed to you, making sure that your needs are met. And I would ask that you use them in any way that you see fit to really get your needs met and get the type of technical assistance that you need. The next role I wanted to talk about briefly was a systems coach, which is really the person who would be working with you on a very regular basis. And the State and Community Information Exchange that you all received, participated in, Denise Stolzbach will be talking about later, gave us some guidance in terms of how you as grantees wanted to receive technical assistance. Some of you wanted coaches, some of you wanted other mechanisms and models to receive technical assistance. And so we do have a series of systems coaches. They come both from Georgetown's experts as well as our consultant pool, and our intent is to match those people to the needs that you've identified and make sure that you are receiving the type of expert that you're looking for in the mechanism you want to. And then finally, when we as the TA Network talk about a content expert, that really is someone that you can access that has very specific content expertise and might be you might be needing their help around the development of managed care contracts and or Medicaid expansion or all kinds of areas, certainly family-run organization work. And in that sense, the content experts are available to you And those of you who have not chosen a systems coach, those of you who want maybe an array of a pool of content experts available to you over an array of areas as you're designing and defining your system of care work in your state and community. So these folks come both from the TA Network staffing as well as our large consultant pool and clearinghouse, and are available either through email or phone call, and are not scheduled with you on a regular scheduled monthly basis, but are more responsive in terms of how you want to organize communications with them. I said before that our consultant pool has roughly 150 individuals, some of which are on this call with us today. And as we send this link out to people so that you're able to disseminate it, this webinar will also provide you with an updated consultant pool list, which will come in advance of the consultant pool kind of link on our website. So you'll have that available to you, and you can see ultimately the names of the people that are actually part of the TA Network. But to give you a quick kind of overview of the expert areas that we've tried to cover in the network, this slide tries to give you a sense of the number of experts and the wide variety of people that you could access when it comes to consultant expert work with your state and community. So I'm going to hand it over to Marlene to be talking about a little bit more on the network.
Hi, everyone. Marlene Meadows, the co-deputy director for the TA Network. And what you're seeing right now is the nationwide TA Network involvement map. And so people have joked since we've been involved that we're the new kids on the block, and to some extent we are as the TA Network, but prior to receiving this contract, all of us have worked together. All of the partners that comprise the TA Network have worked together for years, actually. And so we wanted to put together a map to show what are the states that we're all working in and what kind of information can we bring and synthesize to this broader TA Network in order to best support the grantees out there. And so, excuse me, this is just an illustration of all of the work that we were doing in the states prior to getting this contract. And this contract was really a way to formalize those relationships and really in the hope of providing the most effective, responsive, competent technical assistance that we can to grantees. I'm going to talk a little bit about the TA Network's technical assistance model, and I think many of you have probably received a lot of documentation about what this looks like, and it may or may not make a lot of sense because I know it's somewhat new. And so from this diagram, what we're really showing is we wanted to make sure that we were incorporating implementation science into all of the work that we're doing. So anything that we're doing with communities, we're making sure that we're helping communities move to a place of innovation and ideas and translation and getting to a place to where there's wide-scale adoption within a state. So all of the work that we're doing is hoping to move states to that broader capacity and to really scale up in the work that they're doing. The technical assistance that we provide is supportive, consistent, flexible, accessible, relevant, responsive, and reflective. And you can see there's a triangle here. And in this pyramid, we start with generalized technical assistance. And this is something that's available to all grantees at any stage. This is the weekly TA telegram that you should be receiving, a quarterly newsletter, the webinar that we're having right now, and the other webinars that we'll be having throughout the years. The website, and I'm going to talk a little bit more about technology that we're going to offer in a few slides, but we'll have a website that's going to have a vast array of resources to you, including an online training center where you can go on and do different trainings on a variety of different topics. This is just a place for generalized technical assistance. It's available to everyone. It's a broad-based approach, and we're really trying to design that generalized technical assistance in a way that's based on the needs of communities. So Denise is going to talk about the response from the State and Community Information Exchange, but generalized technical assistance that we provide is also going to be connected to that State and Community Information Exchange. So as we find that there's cross-cutting issues that communities have questions about or topics that they're working on, we want to make sure that the generalized technical assistance we provide meets those needs as well. The sort of level up the pyramid is individualized technical assistance, and this is a much more tailored approach to meeting the unique needs of a state or a grantee. This technical assistance, when we provide it, is still virtual, so it's not on-site technical assistance, but it involves conference calls, access to resources, access to the folks that Michelle describes, so some of those key staff, the technical assistance support coordinators. Every grantee has one assigned to them. They can be available for rapid response. So if you have a question about something that's specific, if you're looking for a document, if you're looking for resources, their go-to for a rapid response of information back to you. We also, if you've been assigned a content expert or a systems coach, those are also people who are going to work with you to pull together other individuals who might be focusing on specific topics that you have for technical assistance needs. They might be providing ongoing coaching. It's a much more individualized approach, and that involves consultation to meet your specific needs. The next level, and this is obviously the smallest group of folks who would be involved in this, involves on-site technical assistance. This is intensive technical assistance that's concentrated, it's strategically focused. It's really for those grantees that are in stages of development where intensive and customized approaches make sense because it's going to accelerate their ability to advance system of care expansion and sustainability. Now, through all of this, so I'm kind of giving you the connect to that other slide. Even though, I'm talking about this as though it's separate or even siloed, it's not. We know that grantees move. There's going to be times to when you're focusing on an area for that 4-month period or 6-month period where you just want generalized technical assistance. You're just getting started. You don't need a different level of in-depth TA. There might be another time 4 months from there where you do need individual TA. And after you get to a point to where you're ready for intensive technical assistance and are requesting an on-site technical assistance visit where we can go and meet and provide a team or a peer group that can provide that on-site TA, and then again move back to generalized TA or individualized TA. When we talk about flexibility, we want to make sure that you know that you're never in one place for a long period of time, and we want to make sure that we're hearing from you through the state and community information exchange, through the work that you're doing with coaches, consultants, and TA support coordinators, so that we're providing that flexibility and technical assistance response. So a lot of the work that we're doing is really focusing on technology-enhanced technical assistance. We will have a website. Right now that website's in draft form. It takes a while to get something that's in depth as what we have proposed up and available. You will hear from us soon that we have a site that's just a welcome to the site that's going to grow in the next few months with significantly more resources. But it will be a place to where you can really go, find different resources, again, have an online training center, and this is going to be a place similar to what you experience with the System of Care campus through the Summer of Learning, to where there's different topics, and you can go in and you can view a training, you can take a test at the end of it and receive CUs for the work that you did. We also are going to have a video repository, and we'll be reaching out to grantees to hear from you. Are there things that have gone on in your community that you actually want to host on, to take a video of and host on our website, to where other communities can go on and view the work that you're doing, learn from it, and perhaps do something similar in their community. So again, it's a way for peer-to-peer learning. We're going to have an interactive map of behavioral health best practices, and this is something that'll be a clickable map to where you can go on and click on Michigan and find out about the work related to behavioral health that's going on in Michigan. A consultant pool repository. So at this time, we are going to disseminate to you a list of all the different consultants that we have available and their areas of expertise, but soon it's going to be something that's a searchable database to where you can type in if you have an interest in a specific topic, family-driven care, and you can find who the consultants and experts are that we work with who can provide you with consultation in that area. We'll also have a searchable resource library, again, same concept, where you can go in and search around different topics and find resources around the areas of interest that you're looking for. We are using social media, so you will soon be getting invitations. Join us on Facebook and follow us on Twitter. We have a YouTube channel that will be posting webinars such as this after they've been recorded, so you can go on and review them. We will have a quarterly newsletter, and again, you've probably experienced the weekly TA telegram. is something that will be ongoing. So if you have information that you would also like to disseminate to communities, feel free to email us with that, and we'd be happy to add it to the TA Telegram. Another addition is through Portland State. It's the video coaching platform. So as you're receiving technical assistance, that individualized technical assistance, you might have your consultant or your coach who would like to connect you with a video coaching platform to where you can upload a video of the work that you've done in your community, a meeting that you've had, and to actually be able to talk through what happened in that meeting with your coach or consultant, and they can see what happened. And lastly, a CQI online survey. So after you have a consulting interaction, so if you have a coaching call, if you have a group of consultants who talk to you, following that call or contact or even the on-site visit, you're going to receive a very brief survey that's just going to ask you, how did things go? You know, do you feel like we're meeting your needs? Do you feel like you're actually going to be able to utilize the work that we did and incorporate it into your practice? Is there additional information that you're going to need assistance on? So just expect that. It's really designed to help us better meet your needs. So it just gives you a little bit more in-depth understanding of the technology and online resources. So we're going to, again, staff that centralized website that's going to allow you to have access to a variety of dynamic individualized trainings and technical assistance approaches. We have a vast array of existing resources and search functions so that you can find those resources. Driven online curricula and train the trainer curricula. So you're also going to be hearing about some of our learning collaboratives in different topic areas to where you can actually join a collaborative, and it's going to function almost like an online course where you meet as a group and you do work together and there are assignments and you end with a certificate in that specific topic. There are going to be state snapshots, again, around the behavioral health issues, and we'll be providing information that details current federal landscape related to children's behavioral health issues. And with that, I'm going to introduce Denise Sulzbach, who's going to talk about the state and community information exchange.
Afternoon, everybody, and as Marlene and Michelle both indicated, I am the other co-deputy project director along with Marlene. And as a state project director for several of these grants for the past 6 years, I've had the opportunity to work alongside many of you and have appreciated that opportunity, and I'm looking forward to working with you in this new capacity. And I get to share with you the information that you told us, which is always fun. As most of you know, we did send out a state information community exchange in November, and we heard back from a large percentage of you. And we will be sending out another one in 4 to 6 months.
Oh,
and
no.
Oh.
Oh, I'm on a conference call.
Oh, no, as response to, you don't want to see another information exchange coming your way. If you don't mind muting your lights, that would be wonderful. So responses we will be looking for in another 4 to 6 months, and the purposes of the information exchange is, again, so we can connect with you and make sure that we're meeting your needs. This responses also help us understand what work you're doing for a couple reasons. Number one, we want to be able to connect you with as many as possible peer-to-peer learning opportunities, and we also want to know what else is going on in the community with regard to other initiatives and grants. We really want to strive to help you organize and help ourselves organize around not being inundated with too much technical assistance from multiple technical assistance centers. So we are really committed to trying to coordinate and work with you in that way. We're also looking for your key priorities so that we can make sure, as Michelle indicated, that we're able to match content coaches to you, content experts and system coaches that best meet your needs. Next slide. Of the responses, we had 64 responses back. Some of you responded once on behalf of an entire state, so that actually represented 67 grantees and 37 states for a 95% return rate. So thank you again for that. This is a fun table. If you take a look at our graph, we have different colors. If you look at the blue, those are the original CMHI grantee responses from the 2008, 2000, and 2010 cohorts. The red are implementation grants, the green are plan grants, and then purple is an average of all the grants across the board. And if you look, number one responses for most preferred technical assistance assistance method were real rapid response as well as access to content experts from our pool to match your needs. And you notice it's interesting that the number one response for planning grants was rapid response. That's no big surprise because we're all under the crunch to get those plans done in time. And then the top response for the CMHI, the original CMHI grants and the implementation grants, was access to the content experts. The two response across the board was assignment to a point person, not specifically an ongoing coach, but a point person that will enable you to access the technical assistance that you need, and those are our tasks, our technical assistance support coordinators. The top three choice across the board is really a tie between the access to online resources as well as the assignment of coaches with expertise. The fourth is our peer-to-peer learning opportunities, and the lowest across the board were the monthly scheduled TA planning calls, online discussion forums, and on-site technical assistance consultation. We asked you what was your top priority areas, and this shows you the top 5 from this information exchange being sustainability and financing at 47%, sustainability, financing 26%, youth and family engagement 19%, wraparound 13%, and family support organization and peer support capacity at 12%. We also listed in the far right-hand corner the states that were represented in those responses. We have many other topics presented to us. It's an open question, and we couldn't list them all, but this was the collective highest rated areas. Next. We also had a question on the information exchange regarding the children's campaign, and of that we had a 58% response rate, with the types requested being toolkits, general social marketing, sharing success across communities, dissemination of campaign theme, and expanding your audiences. With that, I get to pass it along to Catalina Booth. So, I'm so sorry, I'm one slide ahead. We're now going to sequence into areas of focus. We talk about cultural and linguistic competence, youth family, wraparound, systems finance, juvenile justice, and child welfare. And with that, I get to move it over and toss it over to Catalina Booth. Thank you.
Thank you. I am Catalina Booth, as they've explained, and with the Center for Community Learning. And alongside me at the Center for Community Learning, you have Miriam Monsalve Serna. And we partnered with the University of South Florida, and their team is led by Maria Hernandez and Kathy Lazio, who couldn't be with us, as we explained earlier. And so as a team, we form what we call the Cultural and Linguistic Competence, or CC Hub. And so our role is to extend expertise and support in the CLC area throughout the TA network. And if you go to the next, we'll talk about the ways we're going to do that. There are 5 key areas and 5 ways in which we will be doing that work of extending CLC expertise and support throughout the network. As has already been extensively discussed, we will be providing technical assistance and training in the TA, in the CLC context. So I won't go into depth since that's been explained so well. We're going to be providing meeting facilitations to the branch. We'll be working with SAMHSA and their staff to increase capacity and provide staff development in cultural and linguistic competence. And third, we will be providing networking opportunities. This we will be providing for the system of grantees, branch staff, TA network staff, coaches, and subject matter experts. And that is that we will get together, share ideas, and learn from each other. And we'll be doing this both in person and through online peer-to-peer opportunities. And our plan is we're hoping to include a CLC meeting at the Georgetown Training Institute. So please your emails and the newsletters for details as the events draw closer. The fourth we are working in is coordination. We're working closely with the CLC coordinators in the site, with you CLC coordinators and representatives from the state system of state expansion and community grantee site. And so we'll be helping you in the work, and we'll be serving as a point of coordination. And I think this is the area that you will see most tangible things is resources. We're in the process of creating resources that center around cultural and linguistic competence. The first thing we're going to be developing that you will see this year is the CLC Primer, a handbook, how to nitty-gritty of your work in cultural and linguistic competence. As was mentioned briefly, working on and we'll have an online cultural and linguistic competence certificate course. And then we'll also be providing events that focus on cultural and linguistic competence, and we are hoping to kick that first one off early this spring. And we will be doing a web-based resources available to you 24/7. They've been mentioned, but we are currently working on reviewing and posting all those resources out there, ranging from articles to webinars to just basic documents in terms of forming your cultural and linguistic competence practice. On the web nature, we are also going to be having peer-to-peer technical assistance, a way for key sites, coaches, and technical assistant participants to get together to share ideas, and in that way increase search. If you can go to the next slide. Main areas, but our additional work that we will also be doing, as we stated, is coordination and planning with the branch. And as has been explained, we have a pretty wide net of cultural and linguistic competence, a very wide net of cultural and linguistic competence experts, because not just the University of South Florida and the Center for Community Learning providing the expertise. We are working hand in hand with the national partners that were mentioned earlier. So you will have access to a wide array of experts. And we also, as this process goes along, completing major initiatives with peer-to-peer information exchange, content-specific learning discussions, and one thing we hope that we're very excited about is office hours. And these will be online times where experts in the field of cultural and linguistic competence will be available for you to connect with online, and will lead topical discussions and question and answer periods. So that's an overview of our work, and with that I'm going to pick to Lacey Kendrick Burke to talk about youth organization and leadership.
All right, thank you for that introduction. So I am Lacey Kendrick Burke. I'm the Executive Director with Youth International, and of course that stands for Youth Motivating Others Through Voices of Experience. Our primary mission is to work to unite the voices and causes of young people, and a huge piece of that is with mental health issues. We do work across systems, so we have young people all across our network who have been involved with various systems, not just mental health and systems, although that's the primary focus. We also work with young people from child welfare, juvenile justice, young people who identify LGBT and from different minority populations, as well as any other issues, that come up across any of those systems. So we focus on youth leadership, youth development, and infusing youth-guided tools and youth engagement into the work that all of you do. That with the TA network, of course, is to provide technical assistance and expert consultation around youth-guided care and youth engagement strategies, not only for the youth organizations or the youth groups that you might have going on, but for the youth engagement coordinators who work to support them, and also the larger level, so whether it's the state level or the local level, grants and sites to ensure that youth guided principles are infused in every level of the work that you're doing. We're going to do this through several different ways. We currently have a network of 70 chapters across 34 different states. We are working right now to connect whatever chapters are out there with whatever sites are out there. And so if you haven't heard from us yet, you will be. And just making sure you guys are connected with the awesome young leaders that you guys have in your local communities. But then also ensuring that we're building that capacity at the local level, and so helping our young people and our young leaders to be able to provide some engagement and partnership at the local level at the work that you guys are doing. ways that we're doing this nationally. We will have an online learning community, and that'll be really expansive, and we'll do that through a lot of different ways. An email distribution list, social media tools. So we're on Facebook. We also have a private Facebook group just for chapters. Twitter. We're on Tumblr, YouTube. We've got podcasts. Of course, our website, and then we'll be a huge part of the community practice that we're looking at developing. Promoting peer learning opportunities, youth chapters, youth groups, and the youth engagement coordinators. Their similar interests and purpose. We have several different groups who are very strong in some areas, and some groups who struggle in areas, and so we work to connect those so that there are peer learning opportunities for young people, which also helps to promote the leadership development of our young people. Provide guidance and models for statewide and local youth leadership groups and structures to ensure expanding capacity within the state for youth organizations. We have some youth groups and youth-focused initiatives that are very local and like to stay that way. We have some that do focus on the state and want to expand and work with our local youth groups and to help them develop. And so whichever direction it is that the youth or the youth leadership groups want to go in, we can help support that development. We can also help these groups and or sites figure out where it is that they want to go if they don't quite know yet. This through our chapter purpose areas. We have worked with national initiatives and with our young people to define the areas that we have noticed that young people typically focus on and their groups typically focus on. And so we'll have a lot of guidance and resources around happening with those groups and give other groups ideas on if they want to focus on that. Some groups focus only on, some groups focus on all 6, and we'll be sending out more information on those as we go through the year. Or if you'd like to request that information, please get in touch with us. In quarterly chapter calls and discussions. Minimum, we host quarterly chapter calls with primary things that we know are happening in the field. One of those that is coming up is the Mental Health Awareness Day call. We're always really involved with that. We also make sure to drive our calls and our focus from doctors and our youth engagement coordinators. And we'll do the content of these calls based on what you all identify and what the chapters identify that they need help with or that they would like to focus on. We make sure to bring in, co-presenters who have been successful in areas to help present. And then, of course, participating as a partner in the White House Dialogue for Children's Mental Health, as well as other national initiatives, including Recovery Month and Foster Month. Some of the initiatives that we've done are the Enrollment Coalition, SAMHSA, and several initiatives. We do represent youth and the current youth field across different initiatives and through different partnerships. And we do our what we call Generation Next, and so it consists of our National Young Leaders Network, our speaker show, our consultant pool, and our delegate program. And so we want to make sure that we have at rest young people who are trained, who are ready, who are in touch with current issues across the field from young people, and that systems are experiencing and engaging their young people, and that we have people ready and young adults ready to represent that on partnerships and on boards and on working advisory boards and all of that. So we also will be developing trainings around each of those. The concept Generation Next includes reach back to the next generation. We've noticed that as we have developed as young leaders and as professionals in the field focusing on this work, sometimes it's really important to engage the next generation and provide them the same training and support that we had as we transitioned from a youth advocate to an advocate for youth. And so ensuring that we had developed the right resources to be able to make that happen in partnership with young people at each level of generation. Brings me to the last thing that I will say. We do a webinar coming up, and it's going to be on February 25th, so save the date for that. And we'll be talking about the Generation Next concept that we just mentioned. Also, as we transition from a youth advocate to an advocate for youth, the different stages we've identified and the different resources that we've identified have been helpful at each one of the stages, and then also how, as supportive adults, you all and we can help to support the next generation of youth advocates coming up. Up there, a lot more to come, and we're really looking forward to engaging you guys on probably, I think, is one of the most exciting pieces of the work that we're doing, and engaging our young leaders in the work that you guys are doing. So with that, I'm going to turn it over to those who help support the young people most directly, and that's the family organization. And Sandra Spencer is going to go first.
Again, this is Sandra Spencer, and I'm the Executive Director of National Federation of Families for Children's Mental Health, and I'm going to be talking to you a little bit about the National Federation and the work that we're going to be doing with the TA Network. And then following me will be Jane Walker, and she's going to talk to you a little bit about the Family Executive Director Leadership Association. I'm just going to start by just giving you just a brief overview of the National Federation of Families. A lot of you all know us from previous work that we've done with your states and communities for many, many years. We've been involved doing technical assistance to CMI sites for the past 15 years, and we're excited to be a partner with the TA Network. Just as a reminder, the National Federation is a national family-run organization bringing about 150 chapters, state and local chapters in the country. We provide advocacy to a nationwide work of partners and agencies around the country. We do a lot of policy work. We provide leadership and collaboration, all child serving agencies. So we really have a goal to transform mental health care in America and to make sure that the voices of families, the voices of youth and children are heard about all systems. Our work with the TA Network is really exciting because we will be providing TA around family involvement and operationalizing family-driven care. As you know, the National Federation has been greatly involved in defining what family-driven care is and helping folks realize how to do this in their communities at the state level and at their local level. We'll also be providing TA resource development in several areas. One is to identify the strengths and the needs of around family engagement. And we know that people are at different levels when it comes to family engagement. So we'll be working with those who are just starting out and those who have been doing family work for the last few years. We will identify strengths and needs and be able to offer you very tailored technical assistance around your needs with family voice and family-driven care. And so we'll be helping you really implement family-driven practices. We are really going to concentrate on finding out where you are on the continuum of operationalizing family-driven care, and we try to move you forward into some policy development, make sure that family voice is validated in your community, and that family leaders are trained and able and willing and ready to really do family-driven care within the sites. We're also going to be working with some of our other partners and some of our other tasks around child welfare to make sure that we incorporate family voice, family-driven care within child welfare and within juvenile justice. So we are really excited about some of these opportunities to do this with the grant. So now I'm going to introduce Jane Walker with Fretla. She's going to talk to you about some of the, I'm sorry, you can go back to that slide. A couple more things and I didn't realize. So also we're going to be providing some training opportunities, and I can't even believe I almost forgot about this. One of the largest other initiatives that the Federation does is around our Parent Support Provider Initiative. And a lot of you know that we have a National Parent Support Provider Certification Program now where we are certifying parent support providers all over the country. And so we're going to be providing training and technical assistance to all the grantees around how you can better use the skills of parent support providers. Also going to do training around what are the core domains and competencies of these parent support providers and how you can use them to help support you and the families that you serve in your community. And then we're going to also look at how the new Affordable Care Act can help with sustaining certified parent support providers and really talk to you about that. We're going to also use some of our social media activities to improve awareness. One of the Federation projects, as you know, we were involved in Children's Mental Health Awareness Week, and we created a large media and public awareness campaign around children's mental health. Now, we really make sure that we can also support in your communities as you do things around public education, social media. We're going to talk about how you can use that in some of your sustainability efforts. So one of the things that we'll be doing is developing and managing a listserv with all of your lead family contacts and your cooperative agreements within your planning and implementation work. One of the things that we hope to do with this, whoever you identify as your lead person, whether they're with the family organization or just the family leader in your community, we want to be able to get these people together on a monthly basis and to with general technical assistance that they need and working within your sites and within your planning. We create a listserv, and we're going to do monthly calls. So with that, I'm going to turn this over now to Jane Walker with FREDLA.
Hello, my name is Jane Walker, and I am indeed the new kid on the block, even newer than the TA network. FREDLA is a brand new organization, and as of I was appointed the executive director of FREDLA.
Sorry, were you listening?
Jane, if you could mute your phone, please, that would be very helpful. Go ahead, Jane.
Our mission is to empower and strengthen executive directors of family-run organizations that are focused on the well-being of children and youth with mental health needs. Getting an echo, and I.
Jane, computer on mute.
Yeah. Sorry. I'll going. Is that any better?
I heard you twice, but that's okay. Just keep going.
Okay. So FREDLA is going to focus on run organizations and really will complement the work that the Federation is doing in building family-driven care. And our focus is on organizational development, leadership development, and workforce development. And in order to achieve that, we're going to conduct an initial survey of family-run organizations to look at areas of expertise, materials, products, and identify gaps and needs. We're really focused on the stages of maturity of organizations. We know that startup organizations need one thing, and yet for many family organizations, many of them have been around for years. When there's a transition, as the system of care grant ends or a transition in leadership, the organization may experience difficulties. We're going to look at models of family-run organizations, financing, including Medicaid, business practices, and organizational development. So we want the organizational structure of family organizations to be as strong and visible as the systems of care are themselves. We're also developing a resource bank of materials to support family leaders and build the capacity of family-run organizations, develop a family leadership training, a boot camp for new executive directors and possibly for their assistants, so that we're bringing up a whole cadre of leaders throughout the country. We're going to use develop assessment tools, self-assessment tools, measure performance indicators, and to look at capacity building and sustainability, which is the buzzword. That was the top thing noted, and I think family organizations were probably ones to put sustainability at the top of that list as well. About licensing and accreditation are huge issues that are facing family-run organizations across the country, and we will be using the expertise to be able to support family-run organizations as they consider those and as they go through those processes. And lastly, we're going to be looking at specific topic areas, including child welfare and juvenile justice, and using the model of TA that the whole TA network is built on, and that's sharing the strengths of the leaders across the country and their states. Now I'm going to turn it over to Eric Bruns. I'm on the East Coast. I'm going to shoot it across to you, Eric, on the West Coast.
This is Eric Bruns. I'm a researcher here at University of Washington in Seattle, but more important, I'm of a national effort to achieve a critical healthcare priority for our nation's youth and families, as well as for most system of care states and communities, which is to ensure that youth with serious and complex behavioral health and other needs receive care that is driven, youth-guided, research-based, as well well-coordinated, such as through the wraparound process for coordinating care. So to help achieve this, we launched the National Wraparound Initiative in 2004, which is co-hosted by University of Washington as well as Portland State University and my co-director, Janet Walker, there at PSU. And we originally founded the NWI in 2004 to specify the wraparound model and develop some accountability and implementation support materials. But the NWI has evolved over time to provide more direct support to wraparound implementation, drawing from lessons learned from the field from leaders such as Wraparound Milwaukee and, of course, the Institute for Implementation and Innovation there at the University of Maryland, which also hosts the National TA Network. So we're all partners in this work together. So as part of the new National TA Network for Children's Mental Health, we're thrilled to be able to use that connection to in our partnership with the National Network to connect to even more states and communities, because it will allow us to continue to move towards being an even more active support to wraparound implementation and evaluation on the ground level. So as part of the TA network, our task is going to be to, first and foremost, support all grantees' efforts to implement high-quality wraparound and high-quality wraparound. And so what that means is that through our connection to those at the NWI, our many partner communities and initiatives that are implementing wraparound, you can receive technical assistance to support planning of your own infrastructure and financing, as well as sustaining your workforce development model through high-quality training and coaching of folks, the practitioners who are in central roles in wraparound implementation, such as wraparound facilitators, youth partners, and the clinical staff who are affiliated with wraparound initiatives. What it means is that Ts are ready to implement or enhance their implementation efforts. We can be a hub or nexus for providing information around some of the most research-based and effective and practical methods to provide on-site training and coaching. So a core feature of our support as part of the TA network will be to help connect sites to training and coaching resources, as well as, of course, our own fidelity and accountability tools. We'll also facilitate grantees to access what is now a very large, searchable multimedia library of resources on our website. Being to the TA network also means that we'll be supported to continue to produce webinars and newsletters for the field, and help connect all grantee sites to technical assistance about using our fidelity and accountability tools for wraparound. We're going to work directly with a number of grantee sites to develop evaluation and quality assurance plans around wraparound, and an announcement regarding how you can get that kind of specific intensive technical assistance to develop your evaluation and Q plan is going to be forthcoming in the coming weeks. Finally, we will be needed products that will be available to all grantees as well as the field nationally over the course of the first year of the TA network's funding from SAMHSA. including has been previously referenced a remote video coaching tool for wraparound. Here at the Wraparound Evaluation and Research team at UW will be developing and soon using an external fidelity and implementation review process that will be available to all grantees. And finally, a handbook summarizing state implementation models. So that's it for me from here in Seattle. And I think need to mute their phones. But anyways, I'm handing it over now to a discussion of the financing supports through the TA network.
Thank you, Eric. This is Sheila Pyries at Human Service Collaborative, and I've worked with many of you listening in over the years and had that pleasure, and I'm delighted to be working with the Institute at the University of Maryland and with the Center for Healthcare Strategies on hubbing the technical assistance related to the organization and financing of delivery systems. Eric and Michelle both said all of us have worked together over many years. I've served as senior consultant to the Center for Healthcare Strategies, which has been led by Kamala Allen and science there and their colleagues. And the Center for Healthcare Strategies is actually currently running 2 national learning collaboratives. Several of you, many of you, in states have been participating. One that's focusing on care management entities that Maryland actually is the lead state for. It's a 3-state collaborative. And one on a 6-state collaborative focusing on improving the use of psychotropic medications and among in foster care. And also the center has been involved in a Medicaid analysis looking at how children use behavioral health services in Medicaid and the expense associated with that use. And recently the webinar, which we hope many of you participated in or listened in on, will also be archived on the TA Network's website as well as the Center for Healthcare Strategies. I mention this because we're trying to draw synergy across these various related reform initiatives. And in our overall strategic approach, we will be, as I said, hub for TA on organization and financing issues. We will be working as well to support and work closely with the other hubs such as FREDLA and the National Federation, recognizing that the financing and sustainability of family and youth-run organizations, also with Youth Move, is critical. So whatever support we can provide there, with, of course, the National Wraparound Initiative, the Cultural and Linguistic Competence Hub, etc. But we will be available to grantees for rapid response, which can be, as Michelle said, filtered through your technical assistance support coordinators, and we'll try to get back to you very rapidly, as the name says, with answers drawn from not only what we may know, but from the broader consultant pool and core partners. We also will be holding periodic office hours, much like the Cultural and Linguistic Competence Hub will be doing, as Catalina mentioned. We'll be doing that on topics related to the organization and financing of delivery systems, conducting webinars. As I mentioned, we recently did one on Medicaid data. There is another one upcoming on health homes. We'll be sending a notice out around that. We'll be developing issue briefs and a toolkit related to return on investment of systems of care. We believe that the organization and financing of delivery systems is so important, and particularly in health reform and the Medicaid context. And so often we're asked, what is the value added of systems of care? What is the return on investment if we invest resources in systems of care? What can we expect? And so we're going together a toolkit on that will, beginning with a toolkit that comes out of the Medicaid data analysis work that we're doing through the Center for Healthcare Strategies, that can be a resource to other states on how to analyze your Medicaid data around children's behavioral health use, including psychotropic medications, what medications to include in analysis, what services to include, what billing codes to include, type of a toolkit. We're doing a basic kind of primer on how financing is organized in states sort of generically, the role of Medicaid for example, versus state mental health authorities, where state mental health authorities may be controlling Medicaid match, may not be. How to conduct and use return on investment analyses, how to develop case rates, how to establish systems that bring large state administrative data sets together. Those are a number of the things that we'll be doing under return on investment. The next slide, please. Next slide. Hello? Hello?
There, Sheila.
We're also going to be developing a series of resources related to the psychotropic medication monitoring that will build on. Many of you are aware of the Medicaid information bulletins that have come out over the past year and a half, which we're very happy to see from the Federal Centers for Medicare and Medicaid Services related to children's behavioral health and also to psychotropic medication. And part of our organizing framework for this systems and finance work are informational bulletins, at least in terms of how they relate to Medicaid. And so we're doing a series of resources that will draw on those, as well as the work of the 6-state learning collaborative that I mentioned that the Center for Healthcare Strategies is managing right now. And those issue briefs resources will, for example, look at what you're setting up a monitoring system, what types of indicators should you be tracking related to psychotropic medications, and how you define them, so that states don't necessarily have to reinvent the wheel, but can look at, for example, what 6 other states have agreed are the primary benchmarks to take a look at. Looking at consultation models for providers, for families, for child welfare workers and others, and how to finance them, red flag kinds of systems, and informed consent processes. The next slide, please. And we're also creating a series of resources, working closely also with the National Wraparound Initiative on customizing care coordination using wraparound, so that we can look at how to embed intensive care coordination approaches using Fidelity Wraparound into larger, particularly Medicaid delivery systems, for example, through health homes, and other options under Medicaid. And so we'll be initially starting out with a description that's, very accessible, sort of operational description of care management entity and wraparound team kinds of approaches in states. What are the care coordination ratios? How are they financed? What are the outcomes, etc. I think that's the last. Next for a moment, please. So that's sort of a snapshot of what we're looking at doing under organization and financing. And I'm going to turn it over to Susan Richardson, who's going to be talking about reclaiming futures and juvenile justice.
Sheila. Good afternoon, everyone. My name is Susan Richardson, and I'm National Executive Director of Reclaiming Futures based at Portland State University. I'm with Jim Carlton, who is our Deputy Director as well, and we are very happy to be partnering with the Institute and with all of the partners on the call to serve you and your communities. Reclaiming Futures has been around since the year 2000, and we are now in 39 sites in 18 states. We are in many of the states that are represented on the call, but yet in some. But our work and our learning to date will definitely help your communities in dealing with youth involved with the juvenile justice system who have mental health and substance abuse problems. We are not, of course, looking to make you, unless you're interested into a site, but interested in meeting your specific TA needs as you work to get youth treatment and get them back into their communities. Our model, you may be familiar with, looks at more treatment, better treatment, and beyond treatment for youth in the juvenile justice system with mental health and substance abuse problems. We work successfully with these communities in looking at training, assessment, service coordination, initiation of evidence-based practices, engagement, and then the all-important transition and community involvement for reentry, recovery, restoration, and readiness of our youth back to the community in a way that maximizes youth and community voice into our justice system and our treatment system. We have successfully used local teams comprised of our mental health and substance abuse treatment providers, the court, probation, community, and project directors across the country. And what we will be available for is to customize what we learn to your needs there locally, capitalize on your local assets, in addition to connecting with our network of resources and partners in our learning collaborative. We also want to share our robust online learning community based on your needs. Work with cohorts in this group, working with justice and trying to get more mental health and substance abuse treatment. We will also be using technology virtually through office hours, webinars, etc. And we really look forward to working with you to identify issues and focus on the issues that are most challenging to you and your communities. I apologize for my voice and happy to answer questions, but I'm going to turn it on over to Michelle, who will be talking with us next about child welfare.
Thank you, all our partners, for providing this information to the grantees, and thank you to all the grantees who've been asking questions along the way. Just to clarify a little bit, one of the really unique things about this contract is that SAMHSA, the Children's Bureau, and OJJDP have an agreement where there is specific tasks where we are able to provide resources such as reclaiming futures. So that is literally a partnership between OJJDP and SAMHSA on behalf of the grantees. And the same is true about the Children's Bureau for the child welfare component. This is a stay tuned for more information later, as we are continuing to have conversations between SAMHSA, the Children's Bureau, and Georgetown about the best area of focus for these dollars to support the field and really use the resources that are created via the Children's Bureau, their technical assistance, their expertise, and make sure that that is being collaboratively shared, and we're doing that in partnership with Georgetown. So that is a slide to say to be continued, and stay tuned, and we'll keep you up to date as that gets finalized. At this point, we have been answering questions throughout this webinar, but we're wondering if there are other questions that people have. As an FYI, if you want to sign up for the TA Telegram, if you have not already, please use the TA Network's email address to email us and give us your information. We're happy to add you. We intend to send all of the webinar information and any updates that have been mentioned throughout this presentation out through the regular Tuesday TA Telegrams, so you can look for those updates that way and be able to have links and capacity to either access recordings or links to upcoming webinars. It'll all go out through that TA Telegram, so that's a pretty important listserv for you to make sure you're part of. The webinar Lacey mentioned will go out in the information in next Tuesday's TA Telegram, and then obviously this will be posted and available to you to download or forward to colleagues who maybe didn't hear this but you feel like would be beneficial in your communities, and we'll also disseminate some of the additional attachments we talked about, such as the consultant pull list and so on. So that is the mechanism by which to receive that additional information. And then if people have questions, we'd love you to add them into the Q&A. I'm happy to read them, and we're happy to answer them at this point. Stephanie has asked, will general audience communication from all of the network staff arrive via the TA network address, or will be sent from each individual address? At this point, I believe that tasks have been emailing from their own, I'm staring at them right now just so people know, so I'm not messing this up, but they've been emailing from their own email addresses, and that will continue for them. So you'll receive general email information like the TA network will come from the TA network address, and other, large scale will come from them, but your technical assistance support coordinators, which is back in the early slides that I did, that gives you their email address. It also gives you the TA network email address, which is tanetwork@ssw.letter-U and the word Maryland, umaryland.edu. And if we could put that into the Q&A for people right now, into the answer, then they can see it themselves, but that's how the communication's been going. And the way to get into I have another question just about getting onto the TA Telegram, but the way to do it is to email this email address that's going to be posted and is in the slides that we'll be disseminating. Looking to see if there's any other questions. We've had a couple questions about the state and community information exchanges going out, and we're asking anybody who, the state and community information exchanges went out, just so people remember, to the principal investigators and the project directors with the request to work collaboratively with their teams to answer the questions. So please, again, email us and let us know if you feel like for any reason that information wasn't provided. But we did receive information back from really majority of all the grantees and have done phone follow-up and email follow-up with any grantee who didn't respond. But we're happy to take individual questions about that offline and see if there's any ways that we can integrate your thinking into this as well. There's one more question in my Q&A. The timeline for implementation availability of CLC resources such as training.
It's going to be ongoing. Mary, are you still on the phone by any chance? Okay. So we have a plan to start developing the training, and you're going to see information on webinars and signing up for the CLC learning community pretty soon, within the next couple of weeks. And once you have that information, you'll see the ongoing training that's going to be happening. The CLC primer is going to take a little bit of time, but that's something in the works for the next probably 6 months from now. Sources will be up very soon. As soon as we get the website up, which will be in the next month, you're going to start seeing a significant amount of CLC resources on the website. Any other questions that people have?
All right, everyone. We really do want to thank you for your time. We know how busy everyone is and how fast-paced the world that we all work in is, and we look forward to working with all of you to support your needs, to do the good work that you're doing. Please email and communicate with us. We are happy to answer any questions you have and work with you to really ensure that we're supporting your efforts and meeting your needs. So thanks again for attending, and we look forward to either continuing to work with you or building a new relationship with you. Take care and have a good day.